Hello everyone, so welcome to today's video. I'm very excited to introduce Dr. Vaibhav to all of you tonight. Dr. Vaibhav is a senior resident in nuclear medicine at AIMS, and today we'll be discussing about nuclear medicine as a branch for your upcoming NEET PG counseling. बहुत सारे लोगों को यही नहीं पता है. A lot of people don't know that nuclear medicine is a separate branch from radiology. In fact, some people think that radiotherapy, nuclear medicine, radiology is the same thing. So we'll dissect nuclear medicine from head to toe. We'll discuss what nuclear medicine is, how is it different from radiology, what is the course of nuclear medicine, what does it include in the 3 years of training, what are the options after your MD, be it your SR-ship, your fellowships, or in fact going outside India. What are the good colleges to pursue nuclear medicine in India through NEET PG? And finally, we'll discuss salaries at the last. Okay, so I'll put down the timestamps of all the things that we'll discuss. You can jump to your respective timestamps, whatever you want to watch. It will be around 20 to 30-minute video, so I really hope you stick till the end. So first of all, Vaibhav, thank you for joining in. Thank you for coming. एक बार अपना introduction दे दे.
Yeah, thanks Rishabh to providing me this platform. For you are actually doing a very good for all the medicals or passing out medicals who cleared the PG entrance exam. Because I remember at our time of MBBS entrance when we used to give advice to for the pre-medical test, there these kind of platform were very lacking. There were some one two kind of online blogs website. They were also very less reaching website. So we are actually you are doing a great
Thanks,
thing.
yeah, thanks.
Then yeah, and about me, you introduced. I am Dr. Vaibhav, and I have done my MBBS from AIMS Rishikesh, and then done MD nuclear medicine from AIMS New Delhi, and now I am doing my senior residency from AIMS itself.
Thank you, Weber, for that introduction. And I really hope through this series, students get to know about the lesser known branch, because medicine, surgery, ortho, peds, gynae, तो सबको पता ही होता है. रेडियो, डर्मा भी पता ही होता है, more or less ना. ये जो 10,000 to 20,000 रैंक में जो branches आती हैं ना, उसमें थोड़ा people are confused and do not know about these. So first of all,
Yes,
Weber, I will ask you कि how is nuclear medicine different from radiology?
yes. So nuclear medicine, and many people think like radiology, nuclear medicine, radiotherapy, like the same branches, but all the three branches have many similarities. Also have a far apart dissimilar branches. In radiology, usually if we talk about like on the basis of radiology, we generally use the radiation for diagnostic or therapeutic purposes, which actually arise from outside the like nucleus in an atom. Like you usually use X-rays, it can you use the X-rays which are produced outside the nucleus. But in nuclear medicine, we use the radiation which actually produced from inside the nucleus. Like you in the like 11, 12 classes, we have all heard about alpha ray particles, beta particles, gamma rays. So in nuclear medicine, we use the nuclear radiations. Also, from in the radiotherapy, we actually treat the malignancies from a source present radiation source present outside the patient's body. Like in the radiotherapy, we use EBRT or like image guided radiotherapy, the teletherapy. So that the radiation source is actually present outside the patient body, and we throw the beam to the patient. But in nuclear medicine, we actually inject the radiation sources inside the patient body. So it is kind of a precision medicine. So we inject the radiation in the patient body for the diagnostic or therapeutic purpose.
So what are the modalities which are included in nuclear medicine?
Yes. I want to clear like 2 points also for the like the concepts used in nuclear medicine is not actually like very new. It's from the ancient time of the medicine. Like in the physiology, we have studied how we calculate the percentage of intracellular, extracellular water. So we have heard about the radioactive albumin, radioactive water. So the same concepts allowed we use in the nuclear medicine. And also second thing is nuclear medicine is also not limited to that like only cancers only.
Okay.
Like malignancies diagnosis and treatment forms a major part, but in nuclear medicine we practically like do anything with the all the organ system of the from the brain, heart, lungs, GIT, and musculoskeletal system, and practically everything we do.
So it's not just cancer. I think a lot of students think कि
Yeah,
बस हमारा scope है वो cancer hospitals में ही है. Only oncology centers will employ you, but there is especially the fact is true that nuclear medicine is a branch of multi-specialty hospital. It's a branch of
yeah,
corporate hospitals, but it's not only limited to oncology. That's one thing that we want to
yeah,
make
yeah,
right. So Vaibhav, first of all, let's just discuss the modalities because radiology में तो सबको पता ही है
yeah,
X-ray, ultrasound, CT, MR, everybody knows about it. Let's come
yeah,
to
yeah.
nuclear medicine.
Yeah, so I want to divide like nuclear medicine into two parts. One is diagnostic part of the nuclear medicine. Another one is therapeutic part of nuclear medicine. So in the diagnostic part, we have like two kind of modalities. One is the modalities which include the radioisotopes, which emits gamma radiations. So usually, if you remember some kind of physics of 11, 12, so gamma radiation have less kind of killing power and more penetrating power.
Right.
So we use the gamma modalities in the diagnostic purposes. We inject the radioactive material in the patient body, and then we catch through the gamma camera those emitting radiations. So the gamma modalities or SPECT modalities. So we use in the diagnostic purposes, and that have a lot of diagnostic purpose modalities are there. You have heard while preparing for PG also that DTPA scan, DMS scan,
Both.
MUGA scan, cardiac stress, thallium scan, bone scans, and a majority second diagnostic part is PET, positron imaging. That is the at current time that majority of nuclear medicine practices focused on PET scan
PET
due
scan.
to its wide use, and that is its ability to find out the occult malignancies, occult infections in the body. So, and currently the PET CT for most of the malignancies, it is the investigation of choice for the TNM staging. So for to its widespread use, it is the currently the most important modalities. Second part is I want to shift into therapeutic nuclear medicine, where we use the radioactive materials which have high cell killing power. We inject, and it's for the metastatic malignancies. So in the therapeutic nuclear medicine, we see all the like any other clinical modality. We see patients, we see OPDs, we prescribe the radioactive doses to patient. Then to most of patient we for the lifelong we follow up the patients. So it's like both therapeutic and diagnostic branch. So and a new term is coined actually, the theranostic in the
Okay.
current scenario, like using same molecules, we also doing diagnostic and also doing therapeutic using same kind of molecules. So theranostic is a new term in the for the nuclear medicine.
So in therapeutic nuclear medicine, so which cancers do you treat?
Yes. So practically, if we follow the basic nuclear medicine principles, we can treat theoretically we can treat all cancers, and for all cancers, the multiple level research is going on throughout the world. Every like not weekly, I say daily, there are a lot of research papers are published in the therapeutic nuclear disease, but the more famous malignancies, or I would say famous therapies which got FDA approval already, like their number one is thyroid malignancy. Like after thyroid surgery, if there is any remnant thyroid tissues or thyroid mets, so we use radioactive iodine for that. Like other is like PSMA therapy that we use in the prostate cancers. If there is uh, castration resistant malignant prostate cancer which we can't treat with any other modalities, so we use PSMA therapy. Also for like neuroendocrine tumors, we use dotatate dotanok therapies, and for bone pain palliation we use the samarium therapy. For liver cancers we use embolization spheres. For like skin condition keloid we use rhenium therapy. So a lot of therapies has already FDA approved, and all other modalities are in pipeline.
Yes, so one thing that he mentioned was for liver cancer, and yes, like I also agree that so there is a modality called TARE, so trans-arterial
Yeah,
radioembolization, which the other name is SIRT, selective internal radiation therapy, in which we embolize small microparticles within the liver cancer with the help of arterial catheters, and they get deposited within the tumor and kill the tumor from within. So it is like an internal radiation therapy
yeah,
type of brachytherapy sort of thing. So that is again a very important modality in therapeutic nuclear medicine. So this was regarding the uh, residency. This was regarding what the nuclear medicine entails. Now let's come to what the residency is about. What do you learn in residency? How is the residency structured? Because it's a new subject.
Yes. So I would like to emphasize again, like I have divided into diagnostic and therapeutic nuclear medicine. So the residency postings are also according to that. In residency, there is also a component of like physics, medical physics. So because the rate of lot of radiations involved, lot of machineries are involved. So we have to learn like a sufficient amount of physics also. That is not too high-fi level of physics, just basic physics like we have learned in 11 12 in the like modern physics portion of the 11 12 physics, and some added with the nuclear medicine radiation. So that is basic part of physics. So a part of training, even in the MD examination, one paper is dedicated to the
Physics.
radiation, the nuclear medicine nuclear medicine physics. Then in the residency, like every place have their distinct departments or divisions. So if I talk about the aims and PGI also, like the postings are divided into like general nuclear medicine, that include the gamma
Gamma camera.
scans. Then like then one part of posting is in the PET. Then another part of posting in the like therapeutic nuclear medicine, like we see thyroid OPDs, we involve patient for PSMA therapies, the neuroendocrine tumor therapies, and one big part is nuclear cardiology, where we do stress myocardial perfusion imaging, the radionuclear ventriculography, and myocardial viability tests. And also there are a provision of 2 to 3 months of posting in the radio diagnosis department to learn the CT and MRI, because it's a kind of correlative imaging. So we do also with the like, have you have heard the PET CT? So
Hmm.
like in the we also do PET, also the CT, then we fuse the images. Like also we do the PET MRI that is in India. So the radiology training is also essential. So we learn the CT and the MRI part also.
Okay. So I think that quite sums it all what how the radiology rotations, other nuclear medicine rotations happen in your residency. Now let's talk about post MD. So you're done with your MD in nuclear medicine. Uh, Now what are the options after your MD? So be it SR-ship, what are fellowships available? Is
Yeah,
SR-ship necessary? DMs, now you mentioned therapeutic
yeah,
nuclear medicine and opportunities outside India. So we'll go one by one.
yes. So I will divide it into like four parts. One part is you keep remaining the academics, like you there is or DM course available at AIMS New Delhi for the therapeutic nuclear medicine. So or there is some therapeutic nuclear medicine fellowships available. One is I think like PMC Mumbai and SGPGI Lucknow. There is PDCC course. So you can remain in the academics, and that will also count as your academic associate, and you will have an extra degree for the therapeutic nuclear medicine. Another one is the traditional route, like other branches. You can join a non-academic associate. So where you work for the 3 years in the all the division of the department, and subsequent you can further continue in the same like medical college phase, like become a faculty assistant professor, associate professor. So you will be in the institute setup. Another one option is to join a multi-specialty corporate hospital. So it is a private sector, but there will be a like good practices. Like all practices are according to guidelines, and all there will be multidisciplinary tumor board meetings. Also, there will be multiple case discussion. And the fourth, and according to me, that should be your last preference to join a diagnostic center. So you have where you have to just you can report the cases, daily report cases, but according to me that is the least preferred choice because of lack of academic activities, lack of any like discussions.
Yeah.
So these four options are there. If I talk about the fellowship or in the like out of India, so most of places abroad, there are the nuclear medicine is a super or subspecialty of
Radiology.
radiology.
Hmm.
Yeah. So you have to first obtain a degree in the radiology. Even after, if you pursue degree from the in the nuclear medicine from the India, again you have to pursue first the radiology from outside. Then you have to do the fellowship in the nuclear medicine.
Okay. So maybe observerships, 1 month observership clerkships you can get in in some departments. But I think if a
Yeah.
proper board accredited fellowship you want to
Yeah.
do,
Yeah.
you have to go through the radiology route only.
Radiology. If you want to do a nuclear medicine practice, you have to go through the radiology residency.
Okay, so one important question, is SRship required after MD nuclear medicine?
Okay. It's actually personal choices, because if you are confident enough during your MD, like you can handle the department, you can manage the patients, so you can directly join your corporate hospitals or diagnostic centers. But if you are not confident enough, I want to learn more, I want need confidence in my reporting, managing patients, then SRship is like is a good option.
Okay. Okay. Now let's talk about what are the good colleges. So apart from, because we are talking about NEET PG here,
Yeah.
in fact, we'll club both INI-CT and NEET PG because we won't
Hmm.
record this again for an INI-CT counseling. So
Yeah.
what are the colleges? Let's forget good colleges. What are the colleges offering
Okay.
nuclear
Hmm.
medicine course for MD?
Yes. So in the nuclear medicine in India, the academic programs are available only at good places.
Okay.
Only like
Only good
because
good programs are there.
yeah, because the setting up the nuclear medicine department is a bit like challenging
Yeah.
because of multiple factors, like high cost of setting up, then high running cost, also maintaining the equipments. So people usually opens the nuclear medicine department. People or institute opens the nuclear medicine department only after have a good basic clinical departments, or like basic overall infrastructure already developed. So both the MD programs and DNB programs all are available at only good places only in the India.
Okay.
So I will divide it. If we see for the MD programs,
Yeah.
like it is available in most of the INIs, like
Okay.
AIMS New Delhi, PGI Chandigarh, AIMS Jodhpur, AIMS Rishikesh, AIMS Bhubaneswar, AIMS Raipur, JIPMER, yeah, and AIMS Nagpur is soon going to
Start.
start its MD program through like NEET PG. The MD programs are available in the SGPGI Lucknow. Then there is some Tirupati Institute in the Tirupati, like
Okay.
Sri Venkateshwara Institute,
Okay.
and then there is Amrita College in the
Cool.
Kochi.
Kochi. Kochi.
Kochi. They have also very good program. Then some private universities are also starting up the MD courses. Like you remember, just like in the Jaipur, that Mahatma Gandhi Medical College also started the
MGM.
nuclear medicine department. Yeah. If I talk about like DNB programs, so only very good like DNB is hospitals have this program, like in the Fortis Gurgaon, then I've said the Narayana Hrudayalaya, Bangalore, then again
Vedanta.
the yeah, no, Medanta don't have
Okay.
these two college, because again there are many complex, like
ठीक है
high
वो
end setup is required, like, and in the DNB program, like one I remember, like the Nizam's Institute in the Hyderabad also
हैदराबाद.
have, I think, DNB program, uh, and DNB, the Army R&R Reference Research Center of that
They also
Delhi
have.
Army,
Okay, they have
they have DNB program, and there are like three four, I'm not able to collect the names at right. All places are good only. One is RML Lucknow. There are
RM
MD
also.
courses in RML Lucknow.
R
RML Lucknow.
Lucknow, Lucknow. Okay, that also has an MD.
Lucknow. Yeah.
Okay, I want to talk
Yeah.
about Tata Memorial and Baba
Yes,
Town.
yes, yes, yes. How can I forget? Like, yes, yes. Both the Tata, in the Tata Memorial also, and both again, and there is a regional yeah, BARC is the that authority to like monitor all the centers for the
They
radiation.
also have a
It
DM
is
program, I think.
yeah,
No, they don't.
no, no, they have the radiation medicine center. They have, I think, MD program.
Acha, MD program in nuclear
MD,
medicine.
MD, MD, yeah, yeah. And one more, there is initially the first institute probably in the India is in Mass in the Delhi. That army that is under DRDO, they have a diploma program that
Where?
the like earlier in Mass Institute of Nuclear Medicine and Allied Sciences, that is under DRDO of like Indian Defense.
Okay.
So that was, I think, the first institute to provide an academic course in the
Diploma.
nuclear medicine. Yeah, that's diploma in radiation medicine. So most of our like professors at current time were earlier that have that degree, because that time no MD and DNB degree was there
Okay.
in the
Okay.
nuclear medicine.
Take. So I think that's a very good point, in fact, because students who are, getting at 5,000, 6,000, 7, 8,000 ranks, they
Yeah.
are thinking of, maybe joining a periphery radiology college or a private MD
Hmm.
medical college or DMRD or whatever. Uh,
Yes, sir, I want to point out one thing. Like earlier, I joined a DNB radiology course
okay.
at a center, but I left that because
Okay.
of there was no proper hands-on. No, the modalities were under the that
PPP.
contract basis
Hmm.
PPP mode. So that was I was getting exposure only X-ray, 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 X-ray. For the around 7 months, I was seeing only X-ray and ECG
Yes,
only.
yes, yeah. So in fact,
Yeah,
instead of joining a radiology hospital which does not have a good modality, it's better to join nuclear
yeah,
medicine program because subsequently when we'll discuss about salaries, that then you'll get to
yeah,
know that it doesn't really matter whether
yeah,
you're
yeah,
nuclear
yeah.
medicine or you're
Yes, yes.
MD radiology. चलो फाइनल बात पे आते हैं. आई थिंक द मोस्ट इंपॉर्टेंट थिंग दैट स्टूडेंट्स वांट टू नो कि सर पैसा
हाँ,
कितना मिलता है ना. व्हाट आर द
yeah,
सैलरीज फॉर अ न्यूक्लियर मेडिसिन आफ्टर एमडी एंड आफ्टर एसआरशिप.
yes. Before salary, there is one important point also, that is work-life balance.
या.
That fine, because what will you do if you earning 10 lakh a month, 15 lakh a month, but you are not getting to get a good sleep. So what will you do with that much kind of money? So like work-life, it is absolute non-emergency branches, strict 9 to 5 or even less. Sometime branches, if you want like कि भाई मेरे को 5 बजे के बाद बस रुकना नहीं है हॉस्पिटल में, या फिर नाइट को कॉल्स नहीं आने चाहिए, या एनी काइंड ऑफ हेडेक, तो इट्स लाइक properly. Even the radiology, you get emergency duties. Uh, so it's there is no practical no
Emergency.
emergency duties in the nuclear medicine.
Yeah.
Yeah, and usually if you don't have a much caseload, usually 5 o'clock, 6 o'clock, except residency. Residency is so like training program. But after residency, it's strictly like
Jail.
you can have a like go to 5 o'clock, you can go to home, have a watch movie, have a good sound sleep, whatever. And now we come to like uh, salaries.
सैलरीज पे आते हैं
So,
चलो.
yeah, so in like it happens in every branch. Like the present scenario, the it happens in the radiology in the early 20s also. Like very less people are there. Like currently, I want to highlight there are only like with 39 MD seats and around 21 or 22 DNB seats per year only in the India. So and daily, like even daily, I get a like call, 2 3 calls for the nuclear medicine physician required in the every part of India, from north, from the Jammu Kashmir to Kanyakumari, and like Imphal to Bikaner, like everywhere daily many centers are opening, and no, very less manpower, very less nuclear
Very
medicine
less
physicians are there.
specialty there in nuclear medicine that
Yeah.
I.
So and this is the like according to a much senior HODs in the nuclear medicine, it is the like gold and diamond period for the nuclear medicine. Like you are getting just after MD or just after 1 2 year associate, you are getting salaries which are at par with the any like clinicians, experienced clinician of 10 year plus experience in any city. So like salaries are few at. If I want to highlight, if you choose the path of the senior residency or being in academics, it's like all other branches. Like if you talk about central institutes, In the senior residence, you will get around 1.5 lakh per month around, and according to like salary categories of the medical college,
You'll get
you will get
promoted
all
according to that. So let's talk about
promoted
numbers.
according.
Let's talk about numbers. So if you are in a private setup, we'll
Yeah.
talk about both private centers and corporate hospitals.
Yeah.
What are the salaries?
So
MDSR.
yeah, yeah. So if I talk about the private diagnostic centers, so there are not very much difference between if you are like 1 year experience or 10-year experience.
Okay.
Like for the private diagnostic centers, the salary somewhat will be same, not very difference in the salary. At current time, the fresh MD pass out, and if he or she joins like diagnostic center, he'll getting minimum 4 lakh per month
4 lakh per
in
month.
salary. If even in the tier one city, like like in the Delhi or Mumbai, he or she is getting 4 to 5 lakh per month. And if you go tier two, tier three city, I just got a call day before yesterday for a like tier three or like tier four city for a job. They are offering up to 7 to 8 lakh per month for even for the fresh MD pass out.
Okay.
So yeah. So in the diagnostic centers, they can also provide you a higher salary because they have a large volume of patients. So in the fresh MD pass out, the minimum you can guarantee at current times 4 to 5 lakh per month, and subsequently you can go ahead also, like but not very much difference in the diagnostic center if you are like based on experience.
Okay.
If you join a corporate hospital, so if you joined as a just after MD, you will join as a senior resident or like junior consultant there. So salaries differ according to like 2.5 to 3 lakhs to even 4 to 5 lakhs there also. But but as you get experience, you become the associate consultant or consultants or like HOD of the department. Salary will increase to like 5 to 6 lakh per month, can go up to 7 8 lakh per month accordingly, and that is a better option, I think, according to me. If you are getting a good quality of practice, also getting a higher salaries also.
So I
Also,
think
I would like to highlight the therapeutic nuclear medicine part is rising day by day. So as it's like any other clinical branch, like you are doing diagnostic nuclear medicine, you are getting a fixed amount like 4 to 5 lakh per month. And plus in the therapeutic nuclear medicine, like any other clinical department, that's
incentives.
there is no limit. There is no limit. Like as many as therapy you do, you will get accordingly.
Incentives you get accordingly.
Yeah.
Yeah. So I think it's a very good discussion, and I think I really really hope that a lot of students watch this video, because लोगों को पता ही नहीं है न्यूक्लियर मेडिसिन में ना कि क्या स्कोप
Yeah.
है. एंड इनफैक्ट वन ऑफ माय जूनियर्स हु इज इन योर डिपार्टमेंट ओनली, एम सोनिया नहीं है वो,
Yes,
मैंने अमन, हाँ.
yeah, Aman Tilak.
या तो मतलब आई टोल्ड हिम अ लॉट ऑफ, आदित्य टोल्ड हिम, अ लॉट ऑफ पीपल टोल्ड हिम कि यार तेरी जो
Yeah,
रैंक है, तेरी जैसी हॉबी है, तुझे चिल लाइफ
yeah,
चाहिए, वर्क लाइफ बैलेंस चाहिए, तेरे लिए बेस्ट ब्रांच है न्यूक्लियर मेडिसिन.
yes, yes, sir.
तू मत सोच कोई ईएनटी ऑप्था वगैरह. यू जॉइन न्यूक्लियर मेडिसिन, यू विल बी हैप्पी, यू विल अर्न वेल. अपना घर पे एसी कमरे
Yeah,
में बैठ के रिपोर्टिंग करेगा, पढ़ते रहेगा,
yeah,
कैड ब्रांच है.
yeah. Many top rankers are also opting. Like with you, like your like PG batchmate
या आई नो.
was there in the PGI.
आई नो.
Yeah, yeah, he was ranked 13.
या स्वयं जी.
One of my senior, Swamjit. Yeah, one of my senior was ranked 5, Dr. Snap.
हम्म.
So she opted for nuclear medicine. One of my senior also, Dr. Pratik, that he was ranked 16. So like also my some of my junior, they were got like double digit, single digit rank. They left radiology, derma, it's like all matlab, well-known branches, top branches, and opt for nuclear medicine.
लेट्स टॉक अबाउट, ठीक है, हमने अच्छी अच्छी बातें कर ली न्यूक्लियर मेडिसिन की.
Yeah,
लेट्स टॉक अबाउट द कॉन्स ऑफ न्यूक्लियर मेडिसिन, ठीक है.
yeah,
बिकॉज देर आर फ्यू कॉन्स ऑफ न्यूक्लियर मेडिसिन विच both
yeah,
of us know. So let's talk about that. So what according to you are the cons of nuclear medicine?
yeah. According to my cons, I will like point wise 3 4 cons are there, which I also thought about them while opting for nuclear medicine. Number one is if you are a kind of person like who want to get very much like want to become famous, like people
Know about
know you by the name. You see OPDs and there are a lot of 100 patient lines before your OPD. So will not like you will not get that kind of practice because it's always will be a referring branch. Like it's not a primary branch. It is referring for the diagnostic also, for the therapeutic purpose also. It's always will be a referring branch. So it's all like like a radiology only. Like you will not be primary. At very less occasion you will be treated as a primary physician, primary doctor, but majority of time it's a referral branch. Another second is that is second point is about the radiation, but that is not a problem actually. Before joining, or if we heard we use radiation, but after joining you will heard that is not a con
yeah, yeah. That's true for
also. Like
radiology. And look, what I
yeah,
tell juniors about it, like if you're worried about radiation, no, then cardiology,
yeah,
urology, orthopedics,
the orthopedics lie
gastroenterology,
or
like they have
orthopedician
so much
get
more radiation than us.
yeah. And also nuclear medicine we usually use gamma radiations, which are not at very less harmful
Hmm.
like for body, and everything is done under control. There are the regulations, there are safety methods, there are like there is a concept like TDS, time distance shielding.
Yeah.
So everything is done under. I never experienced any radiation injury to me, or whether it's acute or chronic radiation injury. So I never heard like any of my senior or any professors or any junior have like mm, felt like any acute injury or a chronic radiation injury. So it's all safe. It is like don't. One thing also that there is a concept called radiation hormesis. So according to that, this little amount of radiation it is actually beneficial to your body. It actually initiates your reparative processes in the DNA. So it's little much of radiation is also beneficial to your body. Another cons is there will be a capping of salaries at
Yeah,
some
like
level.
radiology. Yeah.
Like yeah, it's happened with every diagnostic branches. Like because you will be not you are not a primary physician, so your clinical practice will not grow like a snowball. Like in the other clinical branches, this the hearsay wala effect होता है, the snowball वाला कि एक patient treat हुआ, then he will tell 10 other patients that this doctor is, and your practice keep increasing and the sky will be the limit. So you will, but the plus point is you will get very good salary just after MD. So you can, it's about like balancing things. Like in the clinical branches, your practice generally starts as around 35 to 40 years, but in the nuclear medicine radiology you will just after MD you will start a very good salary,
Yeah.
and you will be like stable throughout the life.
Yeah, throughout the life. Well, one more important con, what I feel about nuclear medicine is setting up your private practice. So,
Yeah.
which I think is a little difficult in nuclear medicine because
Yes, yes,
a
yes.
lot of
Yeah.
investment required is more. So the advantage with radiology more is key, even if you can set up a small center of ultrasound, just X, it
Yes.
doesn't cost so much, and the returns are pretty good.
Yeah.
That is one drawback of nuclear medicine, but again, the jobs in the current market are so much that you don't really need to open your diagnostic center.
Yeah. Yes. Yes.
So that is all I think about the cons. Apart from that, some few people tell me that oncology, seeing oncology day in and day out, since it forms a
Yes.
majority
Yes.
of the chunk of nuclear medicine
Yes.
practice,
Yes.
gets a little monotonous. But I think that is again
Hmm.
part of any branch. You know, if your branch is focused on
Yes. Yes.
oncology, then you will see those similar patients only. That is true for
Yes. Yes.
radiation therapy as well. That is true for medical
But
oncology,
they,
etc.
yeah, I want to tell like there is oncology, but there are new modalities for other organ systems are day by day coming up. Like currently, I used to see a lot of the neurology cases also. We scans for Parkinsonism. We do scans for like amyloid imaging. We also do like imaging for the drug refractory epilepsies. We do brain dead imaging. Also, there is a big segment of nuclear cardiology,
Hmm.
like that is in the AIMS. It is protocol that they don't if anyone has like cardiac issues, they don't proceed for surgeries before doing the myocardial perfusion imaging, and there are lots of the bone pain palliation. Yes. So there are lots of like, yeah,
I
anything you
think
will not get bored.
yes, yes, and I think nuclear medicine, the नई branch, and a lot of people don't even know ki what potential it has. And I think
Yeah.
if you are getting a good, in fact, most of the DNA program, nuclear medicine programs are good. Uh,
Hmm.
Explore it a little. Talk to your seniors. I think this video of ours is pretty detailed. It tells you everything from your course to your salaries to your good colleges. If
Yeah.
you are open to joining a paraclinical branch, like, and you're not getting radiology, and you think you wanted radiology only, so do
Yes.
consider
Yes. Yes.
medicine,
Definitely.
because it is a very, very good branch, high paying branch, satisfying branch, good work life balance. So
Also, your like lifestyle will be like radiologists only.
yeah.
The your work culture, everything as part like radiologist, plus no emergency duties.
That is true.
Yeah.
Emergencies, I think radiologist, they, yeah, duties लगती हैं, but most of the
Yeah.
radiologists,
Yeah.
after they become little senior, they employ juniors,
Yeah.
because the workforce in
And
radiology
that is in the,
quite, workforce in radiology is quite big now.
yeah.
So
Yeah.
emergencies तो एक time तक लगती हैं आपकी duties, but yes, nuclear
Hmm.
medicine में practically no emergencies are there.
Yeah.
बाकी in fact, it is a very good academic branch itself also, if you want to
Yes.
do
Yes. Yes. It is
research.
academic rich branch like radiology. मतलब,
Yeah, very
yeah,
academic.
but be prepared. Yes. Sir, be prepared. Ki you have to study a little extra, just
Yeah,
like radiology. Like,
exactly. So just like radiology, you have to study a lot in your residency because it is a
because
totally
you are,
branch.
and also you are concerned with the whole body organ system.
Yeah,
That is the one more. Like,
that is again, yeah. So आपको सारी
you have
डिजीज
to,
के बारे में थोड़ा थोड़ा
yeah,
पता हो.
सारा details. Yes, sir.
तो चलो, thank you, Vaibhav. I think we'll wrap up today.